I'm Marie from Medical Channel Asia, and today I have with me a very special guest. Hello.
Hi, how are you?
How are you?
Good, very good.
Yeah, you want to introduce yourself?
Yes, my name is Dion Warren. Thank you for the invite today. And I'm with Takeda Pharmaceuticals, based in Singapore, and responsible for India and Southeast Asia part of the world.
Right, so there's been some pretty big news going on with Takeda and one of their new products. You want to talk a little bit more about that?
Yes, sure. So we're tremendously excited at Takeda to participate in the movement to impact dengue, one of the top 10 global health threats. We've recently received approval, a regulatory approval in a number of countries in Latin and South America, as well as Southeast Asia and Europe. And we continue to bring a new dengue vaccine forward as part of dengue management and control efforts.
Okay, so how long has it been since it's been approved? How accessible is it at this point of time?
Wonderful question. Yes, so the Dengue or TAC-003 vaccine is approved in over 30 countries worldwide. It is currently launched and available in Indonesia, in Thailand, also in Europe, and several countries in Latin America. In Indonesia and Thailand, it's been launched for a number of months earlier this year, and we've seen very rapid uptake so far. Maybe I'll say a few comments about dengue before talking about TAC-003. So first, dengue, as I mentioned, is a top 10 global health threat. Today, we have over 100 countries that are endemic. 50 years ago, that was fewer than 10. So you can see just the explosion in cases of dengue, and also a significant number of hospitalizations and even deaths happen annually. So for TAC-003, we're really excited about this new vaccine. We've seen 80% efficacy in reduction of the number of dengue cases after 1 year, and over a 90% reduction in cases that have been hospitalized, which is a tremendous impact on patients, their families, and the healthcare system. This combined with over 4.5 years of long-term follow-up, we've seen no safety risks identified, and you can use this vaccine in patients that have had dengue previously or that have not had dengue previously.
Understand. I think that's really a get. So there's been a lot of information out there about Dengue and its safety and efficacy data. Maybe you want to explain a little bit in layman's terms what exactly it means to us.
Sure. Yeah, sure. So with TAC-003 or Dengue, it's been studied in over 28,000 people in phase 1, 2, and 3 settings in endemic and non-endemic countries. Our phase 3 study, which I think you're referring to, was recently completed in over 20,000 people in endemic countries specifically, including Asia. And what we saw there was an 80% vaccine efficacy, which means a reduction in the risk of dengue. In layman's terms, without a vaccine, if you happen to have 10 people that had dengue, if you had the vaccine, you'd have 2. So 8 fewer, 80% fewer. Now, similarly, we saw a 90% reduction in hospitalized cases. That's a tremendous impact for those patients, the families, and the healthcare system. So without a vaccine, if you had 10 cases that were hospitalized, with the vaccine, you would only have 1 case. So again, a 90% reduction there. That's really big, again, for society and the healthcare system.
So I know that there's many different vaccines and they all have different indications for different populations. How does that work for Dengue?
Yes. It's hard to keep that all straight for all these vaccines, but for Dengue specifically, what we're looking at is roughly a regulatory label approved that's from 4 years old plus. In some countries it stops at 60, but the label is quite broad for both the children and adults, 4 years old plus. It's much broader than many vaccines. So it's a strong endorsement for the potential for this vaccine for all age populations above 4 within the country approved label. Recently, SAGE, which is a recommending body for WHO around vaccinations for public programs, have recommended use for public programs between 6 and 16 based on the hospitalized rates there. So that's really strong endorsement to incorporate it into national programs. And we are currently awaiting WHO to consider those recommendations and issue a final recommendation and position paper on that.
So how do you envision Takeda's contribution in the overall fight against dengue?
Yes. I think for all of us at Takeda and beyond as citizens of the world, I think we have a once-in-a-lifetime opportunity to make an impact together on dengue. We believe TAC-003 Dengue will be a part of it, but it's going to take partnerships. and an effort towards dengue zero 2030. We want to see zero deaths from dengue by 2030, and that will be achieved through multiple partnerships in a movement, including vaccination as part of dengue management and control.
Thank you for your time, Dion. Where can we all learn more about Takeda, Qdenga, and the fight against dengue?
Yes, you can go to knodengue.com for consumers and dengueacademy.com for healthcare professionals.